Okay, so about the complications of hepatic encephalopathy, okay. There are 5 groups of complications: metabolic, acid-base, hematological, CNS, and multi-organ failure. Metabolic complications include hypoglycemia, hypophosphatemia, low potassium, low magnesium, low sodium, low phosphate, and low glucose. All these are the metabolic complications of hepatic encephalopathy. As acid-base balance, there will be respiratory alkalosis and metabolic acidosis. Hematological problems include DIC, coagulopathy, and aplastic anemia. In the CNS, there is seizure and cerebral edema. Multi-organ failure includes shock, sepsis, shock, pulmonary edema, pancreatitis, hepatorenal syndrome, acute tubular necrosis. So these are all the multi-organ failure. So under 5 subdivisions of complications of hepatic encephalopathy: metabolic, acid-base, hematological, CNS, multi-organ failure. So the most important thing is going to be Terry's nails. Terry's nails is a physical finding in which the fingernails and slash or the toenails appear white in color, the characteristic ground glass appearance with no lunula. So like the person does not have any lunula. The condition is thought to be the toenails appear white in color. The condition is thought to be due to decrease in vascularity and an increase in the connective tissue within the nail bed. So blood vessel ಕಮ್ಮಿ ಆಯಿடும், but then the connective tissue ಜಾಸ್ತಿ ಆಯಿடும். With the condition known as Terry's nails, the tip of each nail has a dark band. Sometimes this can be attributed to aging. In other cases, it can be because of a sign. It can be a sign of serious underlying condition like a liver disease or congestive heart failure or diabetes. Okay, a physician should be consulted with Terry's nails. So the person does not have lunula, and near the tip of each nail is going to have some dark band. It's because of decreased vascularity and also increase in the connective tissue with the nail. Yeah, it is seen in hepatic failure. The most common cause is hepatic failure. Apart from that, cirrhosis can also be there. Diabetes mellitus, congestive heart failure, hyperthyroidism, and malnutrition. So it's about it. Clinical stages of hepatic encephalopathy, stages 1, 2, 3, 4, and 5. So about the mental status and also asterixis and ECG. In stages 1 to 3, okay, 1 to 4, it's going to be triphasic wave, and in stage 5 alone, there is a delta wave. Asterisk is one, it is present or absent in case of stage 1, it's present always in case of stages 3, 2, 3, and 4, it's absent in case of stage 5. The mental status in the order of the first stage is euphoria, depression, slurred speech, mild. Stage 2, confusion and sleep disorder will be there. Stage 3, we expect lethargy and moderate confusion. Stage 4, there is marked confusion and incoherent speech and stupor. So, and 5 is coma. So, like first one, they'll be very happy or very sad, and they don't speak properly. Okay, mild slurred speech will be there. So, very happy, very sad, and on the euphoria and depression. That is stage 1. Stage 2, confusion starts and sleep disorder starts. So like they'll be confused, so they will lose their sleep disorder. Stage 3, there will be moderate confusion, and then they'll be like, should I do this? No. So like they will be lethargic. Stage 4, they'll be so confused, market confusion, அவங்களுக்கு எதுவுமே புரியாது, and then incoherent speech, அவங்க பேசுறதும் நமக்கு புரியாது, and then they'll be undergoing stupor. Okay, and then stage 5 is coma, எதுவுமே பண்ண மாட்டாங்க. So that's about the clinical stage of hepatic encephalopathy. The mental status is done. Asterixis is may or may not present in case of stage 1. It's always present in stages 2, 3, and 4. It's absent in case of stage 5. ECG, triphasic wave in case of 1, 2, 3, 4, and in case of 5, it's a delta wave. Asterixis is a classical sign in case of metabolic encephalopathy. Okay, so in this video, we saw the complications of hepatic encephalopathy. We saw about the Terry's nails, and we also saw the clinical stages of hepatic encephalopathy. Okay. So the the complication of hepatic encephalopathy is going to come under 5 different categories like metabolic, acid-base, hematological, CNS, and multi-organ failure. Because it's hepatic encephalopathy, CNS finding is the most important one. There will be seizure and cerebral edema. அதுக்கப்புறம் multi-organ failure, hepatorenal syndrome, pulmonary edema, pancreatitis, most important ones. Acid-base imbalance, we know MAC will be there. MAC is metabolic acidosis, and the opposite, RALC, will be there, respiratory alkalosis. Terry's nails is because of, okay, no need, never mind.